where we left off. Okay, do we have somebody coming in? Okay, so bone markings. Bones have little bumps and ridges and uh, facets from flat places. The bones have all type of little arrangements for muscles, the tendons and ligaments to hook onto, and so on. Uh, so uh, just read through this right here. Uh, Introduction to the surface features of bones. So, what are these surface features? A head, a little bump, a neck, uh, fossa is a flat area. You have spines, you have lines, you have other extensions that are involved in joint formation and where ligaments hook on and where uh, the whole bones are held together in joints and where tendons attach to muscles and so on. There's two types of skeletons: the skull, the thoracic cage, and the sternum are the uh, axial skeleton. The appendicular skeleton is the all the limbs, the pectoral and pelvic girdle. So you should know all of these bones uh, of the both the uh, axial skeleton and the appendicular skeleton. That's the back view. Okay, so what the bones that you'll have to know will be what's on WebAssign. So if you do your homework and you do the practice test, those will be the bones that you uh, will be responsible for. So let's look at the bones of the cranium. Uh, the temporal bone is one of the bones of the skull, parietal, frontal, the sphenoid bone. So these bones will be tested in WebAssign. So basically, you should know the parietal, frontal, temporal, and know the sutures. Those are where the bones are joined together. Bones of the face. So we repeat these frontal bones and so on. So uh, you have the zygomatic bone here, and the lacrimal bone basically has the tear ducts around it, nasal bone, uh, vomer. So your job is to do WebAssign and to learn the bones that are presented in WebAssign. If you look at the base of the skull, you have the occipital bone, and we'll have very little information on these canals, but you should know the temporal bone and the frontal bone and these various bones that make up the base of the skull. So your job to repeat is to make sure that you just do the WebAssigns and become familiar with the bones that are uh, explored and assessed in WebAssign. Uh, if you again make a slice through the skull and look at the view, you have the foramen magnum. Uh, you have the sphenoid bone, which has the silica turcica, and that's where the pituitary gland sits. And the cristagalli and the cribriform plate are part of the ethmoid bone. So repeat ad nauseum or ad infinitum. Do the WebAssigns, and that's what you'll be responsible for. If you look at the sagittal section of the skull, uh, you should be able to recognize the bones of the skull, like the occipital, temporal, parietal, frontal, and then the sphenoid bone right here. And in front of that will be the ethmoid, the vomer, which is in the nasal cavity, palatine bone, which is the top of your palate, and so on. Uh, the ethmoid is the bone that forms the nasal conchae. The nasal conchae are the uh, bones that make up these specialized structures in your nose to help when you breathe in air to swirl that air and to warm it up and to make sure that it's filtered. The sinuses, just have a general passing comment on that. Don't worry about it too much. The hyoid bone is a specialized bone right above uh, the trachea. It allows for attachment of muscles uh, for speech and for being able to use your tongue to consume food and so on. A newborn, uh, we won't have many questions on that. It's basically as the, the same as the uh, structures. They just uh, have to grow and fill out with fetal development. So we'll skip through that. Then we have the bones of the uh, vertebrae of the column, the spine. Uh, we won't worry about the curves. So, but you should know the cervical, thoracic, lumbar, and sacral parts of the spine. You should be able to recognize parts of uh, the disc, parts of the thoracic cage. So, what does that mean? That means that we have different shaped vertebrae depending upon the location in the spine. So, you should know the general uh, body, uh, the vertebral foramen, the spinous processes, the transverse processes. So, you should be able to recognize a typical cervical vertebra. Then we have a thoracic vertebrae. It has all the same structures, but the body is much bigger, and uh, it's part of the thoracic part of the spine, and that's as you move from cervical to thoracic. So you have these different vertebrae that make up the vertebral column. The lumbar has a much larger body and a different shaped vertebral foramen or opening, and so should recognize uh, the spinous processes and the transverse processes in the various parts of the uh, of the of a classic lumbar vertebra. Okay, the first two cervical vertebrae are the atlas and the axis. Uh, it has a special process called the Dens or odinoid process, oditoid process, and those are the C1 and C2. So the atlas is C1. So the occipital condyles of the skull articulate and sit and on this uh, atlas, and that allows flexibility and movement of your neck and of your skull about the various directions that your skull can move. Okay. What about the sacrum? The sacrum protects pelvic organs and so on. And you should just basically know and recognize the sacrum and the coccyx. The coccyx is the tailbone. The sacrum is a series of fused vertebrae that uh, form this sacral bone. Uh, we'll basically just have to recognize the sacrum. Okay, what about the thoracic cage? We have the thoracic vertebrae, the ribs, and the sternum. So you should know the parts of the sternum, uh, the ribs. I'm not going to emphasize false ribs or true ribs, but you should just recognize parts of the sternum, and which is in the manubrium, body, and xiphoid process. Again, here's the parts of the sternum, and uh, you should generally know uh, the ribs. We won't talk about true ribs or false ribs too much. We just know that there are cartilage that connect the various ribs to the sternum. Okay, then we can look at the pectoral girdle. Uh, so we just want you to know parts of the scapula, and those will be covered in uh, WebAssign assignments. This is the clavicle bone. So if we go back to the, uh, they don't show it here, uh, the clavular articulation. Okay. So to make sure you know the parts of the scapula, uh, we'll get into that as we move down. So that's in the appendicular skeleton. So the clavicle bone is uh, connects the to the sternum, and it articulates with the scapula. So here's the parts of the scapula. Uh, if you look at this anterior view, you should know what the acromion is, the head, the coronoid process. Here's the acromion from the anterior view. Here's the acromion from the posterior view. The glenoid cavity is where the humerus articulates with the scapula. Let's look at the bones of the humerus. Uh, in general, you should know the uh, parts that are represented and assessed in WebAssign. Then you have the radius and the ulna. Again, we'll have parts that you have to know will be in WebAssign. Then we look at the carpal bones. We're not going to have you memorize scaphoid, trapezium, and so on. We just want you to know that we have metacarpals and phalanges. The pelvic girdle is formed by two hip bones. You should know in general the structure of the pelvis. So it articulates with the sacrum. Then you have the ilium, ischium, and pubis, and this is the pubic symphysis. So two uh, coxal bones form your hip structure. You can look at this view of the pelvis, the three parts of the ilium, the ischium, and the pubis. This is the acetabulum where your femur articulates with the hip or the pelvis. Uh, Again, we'll have general knowledge of these bones. The ones you got to know will be in WebAssign. Okay, let's stop there. Go back to record because I want to keep these under 15 minutes. And stop recording.